Hello. Merci de nous rejoindre aujourd'hui pour notre événement Valorisation du travail de soins, leçons de l'Écosse et du Nouveau-Brunswick. My name is Rachelle Pascoe-Deslauriers. I'm Assistant Professor in the Ron Joyce Center for Business Studies and in the Women's and Gender Studies program at Mount Allison University in Sackville, New Brunswick. Before we begin, I'm joining you today from the area known as Sackville, New Brunswick, which is located in the territory of the Mi'kma'ki, the unceded ancestral territory of the Mi'kmaq people. It is upon the unceded ancestral lands of the Mi'kmaq that Mount Allison University is built. Our relationship and our privilege to live on this territory was agreed upon in the Peace and Friendship Treaties of 1752. Because of this treaty relationship, it is to be acknowledged that we are all treaty people and have a responsibility to respect this territory. Good morning. I also want to acknowledge the presence of some of our dignitaries that are here today, including the Liberal member of the New Brunswick Legislative Assembly from Caraquet, Isabelle Thériault, and without further ado, let us begin today. Nous lançons aujourd'hui un projet de recherche que j'ai développé conjointement avec la Coalition pour l'équité salariale du Nouveau-Brunswick. Notre projet est intitulé « Valoriser le travail dans les soins communautaires et sociaux au Nouveau-Brunswick, une mise en perspective internationale pour améliorer les conditions de travail au secteur de soins » et à l'appui du Conseil de recherche des sciences humaines et le Fonds Marjorie Young Bell de l'Université de Mount Allison. Ce partenariat s'appuie sur les efforts importants et de longue date du secteur pour valoriser le travail et améliorer les conditions de travail et de rémunération du personnel de soins. Beaucoup d'entre vous ici aujourd'hui et nos intervenantes ont contribué à ces efforts. The efforts of the sector have involved collaboration, coalition, and partnership work between representatives of employer and employees in the sector, as well as representatives of government departments. As you will hear from our panelists, these efforts have included labor relations and unionization, certification in the sector, and job evaluations to understand the extent to which work is undervalued. Our project looks to build on this existing work and to consider how these aspects are connected and to give space to consider the ways in which work and job quality are shaped and structured by features of the delivery models. When we're talking about the care sector, we're talking about all the work in the services caring for people living with a disability or mental illness, older adults, people who need support to get by. And these services can be delivered to people in the home or provided in a residential environment. Au Nouveau-Brunswick, il y a environ 650 centres-services et organisations avec environ 10 000 à 12 000 travailleurs qui offrent des services de soins communautaires privés pour plus de 15 500 adultes dans la province. Les organisations qui offrent ces services de soins communautaires sont de différentes grandeurs. La plupart sont très petites, mais certaines sont d'envergure nationale. Les organisations sont soit à but lucratif ou à but non lucratif. Les services sont subventionnés en tout ou en partie par le gouvernement provincial, surtout par le ministère du Développement social. Bien qu'elles soient autonomes, ces organisations et dont ceux qui y travaillent sont dirigés et financés par le secteur public. La configuration du modèle de service, qui inclut des demandes par réquisition de services, le modèle de financement et autres arrangements contractuels, crée pour ceux qui travaillent dans le secteur des conditions d'emploi qui sont similaires aux relations d'emploi multiparties et de sous-traitance. La main-d'œuvre du secteur des soins au Nouveau-Brunswick est composée surtout des femmes, presque 99%, et a longtemps été systématiquement sous-valorisée et sous-payée. Comme Johanne Perron nous en parlerons, Selon les analyses récentes de la Coalition pour l'équité salariale du Nouveau-Brunswick, on estime une sous-valorisation entre 6,67 et 10,73 par heure en 2020. En plus de la sous-évaluation des salaires, les emplois dans le secteur sont des emplois physiquement et émotionnellement exigeants. C'est bien documenté au Nouveau-Brunswick, au Canada et à l'échelle internationale. La qualité d'emploi pour le personnel du secteur des soins n'est pas seulement une préoccupation sociale et économique, bien que les impacts des faibles salaires, de la précarité et des exigences du travail touchent principalement les femmes et les personnes racialisées. La qualité des emplois dans le secteur a une incidence sur la qualité des soins que reçoivent les populations vieillissantes et vulnérables. So any discussion of strategic improvements to the quality of care is inextricably linked to discussions about the work and the employment of people providing the care, such as the skills they have, the pace at which they work, the number of competing demands they face, the time they have to complete tasks and between tasks. And this is exacerbated by added cleaning and PPE requirements in the pandemic, the skills and the experience they have, how much judgment or discretion that they can use in their work, their commitment and ability to be at work, and the location of that work when the care is needed. When we're talking about how care is going to be received, the other side of that coin is how and under what conditions those providing the care do their work. The COVID-19 pandemic has highlighted the centrality and the fragility of current models of care delivery in New Brunswick, in Canada, and around the world. Workforce concerns exacerbated by the pandemic, such as staffing shortages and workers as vectors of transmission due to multiple work sites and multiple employers because of hours and income insufficiency, are inextricably linked to the conditions of employment in the sector. And these are neither new nor unique to New Brunswick. New Brunswick, therefore, is not alone in facing these challenges. Many places are or have been engaged in partnership or sector-wide reviews and initiatives to improve the delivery of care as well as working conditions. And our project looks to connect with work that's happening elsewhere in the country and in other countries to better understand what works and what we might do differently to improve work and working conditions for those in the caregiving sectors. And it's in the spirit of learning from elsewhere and considering the interconnections in the system that create conditions of work and employment that we are delighted to be hosting today's webinar. Nous commencerons par une table ronde qui mettra de l'avant 3 initiatives du Nouveau-Brunswick pour valoriser le travail de soins. Par la suite, notre conférencière invitée, Professeur Patricia Findlay, parlera de l'expérience de l'Écosse. La table ronde et la conférence de Professeur Findlay seront suivies par une période de questions. Nous terminerons par une discussion générale. Si vous avez des questions pour les panélistes ou la conférencière invitée, inscrivez-les dans le Q&R et indiquez à qui vous les adressiez. Vous trouvez le bouton Q&R au bas de votre écran. We will have time immediately after both the panel and Professor Findlay's address to put forward any clarifications or specific questions arising from the speaker's work. Please add them to the Q&A as they occur to you over the course of the event, and we will collect them. We welcome you to also think about questions that connect between the speaker's subjects, as well as the idea of learning from elsewhere. And we're going to bring those questions back when we welcome all of our speakers back as part of our roundtable dedicated discussion about learning from elsewhere to value work in community and social care sectors. So without further ado, it is my pleasure to welcome our first panelist, Laurie Anderson. Laurie is a human services counselor in a community residence and the president of the New Brunswick Community Service Union. Welcome, Laurie.
Good morning. I'm Laurie Anderson, as I was introduced, and I'm from Woodstock, New Brunswick. I'll start by giving a little bit of my background. I have worked for 27 years in residential care for adults with developmental disabilities and mental illness. I graduated with my Human Service Counselor Certificate from NBCC in 1998. I currently work full-time for a not-for-profit agency for adults in my area, as well as hold a part-time job at a daycare. I'm president of my own local and president of the Nouveau-Brunswick Community Service Unions, the province-wide group representing caregiving sector employees. I'm pleased to be here today to participate and speak on behalf of the Canadian Union of Public Employees, or CUPE. Here's a little bit of background information on CUPE for those who do not know about it. In New Brunswick, CUPE represents around 28,000 workers, with approximately 12,000 in the community care sector. The NBCSU represents around 500 of those workers. This includes youth homes, transition homes, food banks, group homes, and adult residences around the province. We are not to be confused with nursing home workers, which we are oftentimes compared to one another. The vast majority of employees in my sector are not unionized. Only about 5% of workers in this type of care service belong to a union. And these union locals are usually quite small, and they deal directly with the not-for-profit board or for-profit employers that run the residential facility or agency where they work. These workers who are unionized do not negotiate together as a central group. They are unique to themselves and they negotiate separately and individually. These individual negotiations are direct with the employer, not the government. The government provides the funding for the care sector services directly to the not-for-profit boards or for-profit companies and regulate the sector operations to some extent. But the provincial government is not the employer. And the employees or workers are not government workers with standardized benefits or pensions. These benefits have to be negotiated among the employer and the unions. The NBCSU and CUPE are committed and continues to try to improve the quality of life for all working people, unionized or not. We try to continue to implement a provincial bargaining structure to negotiate a fair agreement for all workers. We uphold the rights to decent wages and working conditions, safe and inclusive workplaces. We continue to bring the issues forward, mostly about wages, because we are the lowest paid under the long-term care. And by lowest paid, I mean that the average wage is between $14 to $16 an hour. It has become a sector in crisis because of these low wages, with little to no benefits, recruitment and retention issues, and health and safety remains an underlying concern because of the lack of workers in this field. It has led to employees working double shifts and extremely high burnout rates because of employees who are working oftentimes 2 jobs to survive and to pay bills. Recruitment and retention in this field will always continue to be a barrier in this area until the wages and benefits or pensions are recognized by the government. Workers are leaving due to these main issues. The NBCSU has been successful in having meetings with the Minister of Social Development, but our work is far from being over. The primary gain is to have more effective communication with the government and other workplaces to ensure better benefits, working conditions, and to attract and retain workers in this caregiving sector. The challenge remains to have the government value the workers who are predominantly female and see that services that they provide are to some of the most vulnerable citizens of the province as essential. To provide the government to stop undervaluing our work and to be terribly underpaid. The arrival of COVID has brought additional stress to the already overworked employees, such as added rigorous cleaning procedures, wearing masks and PPE for long periods of time, and simply testing positive for COVID. And by following the rules, most workers are not paid for their sick leave while in isolation. We would like to gain help and financial support for these workers. These are added challenges that the union faces in the caregiving sector. It's our government's social responsibility to provide fair wages and adequate working conditions. I was lucky enough to be asked to sit on the Job Evaluation Committee for the Coalition of Pay Equity, and it gave us a clear picture of what fair wages should look like in this sector. It also highlighted the need for legislation to make pay equity legislation come to fruition. The NBCSU will continue to push for this as well. I recently visited my local MLA in the hopes to educate and bring awareness, and I will continue to do so and to carry this message about our sector in crisis. I'd like to thank you for the invitation to speak today. I look forward to learning and hearing from the other speakers. Thank you.
Thank you so much, Laurie, and thank you for all the work that you do. Maintenant, je souhaite la bienvenue à Johanne Perron, la directrice générale de la Coalition pour l'équité salariale du Nouveau-Brunswick. Johanne?
Bonjour. Je vais présenter un PowerPoint. Alors, je vais tout de suite partager ceci. Et moi, je vais parler en français. Alors, ce sera important d'avoir l'interprétation, peut-être. Juste un instant. Voilà. Donc, je vais repartir à partir de zéro. Donc, la coalition, j'aimerais vous dire quelques mots de la coalition comme telle. La coalition pour l'équité salariale du Nouveau-Brunswick milite pour le droit à l'équité salariale et à des conditions de travail justes pour les femmes. On a été fondé en 2001 et on a présentement 100 organismes et 1000 personnes qui sont membres. Il faut que je clarifie ce qu'est l'équité salariale. Souvent, les gens mélangent l'équité salariale avec la parité salariale. La parité, c'est un salaire égal pour un travail égal. On pourrait comparer une caissière et un caissier qui travaillent à la même épicerie, par exemple. On compare une pomme avec une pomme ici. Mais l'équité salariale, ça va plus loin. On compare des emplois à prédominance féminine avec des emplois à prédominance masculine. On peut comparer une caissière dans une épicerie avec l'étalagiste. La caissière, c'est un emploi à prédominance féminine, mais l'étalagiste à prédominance masculine. On compare la valeur. Si la valeur est la même, le salaire devrait être le même. Donc, on peut dire qu'on compare des pommes et des oranges. Pourquoi est-ce que c'est important de faire ça? C'est parce qu'on s'est rendu compte que les emplois à prédominance féminine étaient souvent sous-valorisés. On voyait ça comme facile pour les femmes de faire ce travail-là. Ou bien non, on se disait, ben, tu sais, elle a un mari peut-être qui va s'occuper d'elle. Donc, c'est des vieilles idées qui ont influencé les systèmes de rémunération puis qui nous influencent encore aujourd'hui. Donc, c'est important pour régler ce problème-là de comparer des emplois. Maintenant, les gens nous disent souvent, oui, mais comment compares-tu une pomme puis une orange? Bien, on peut le faire si on le défait en petits morceaux, si on regarde la grosseur, les calories, le gras, les protéines. Si c'est semblable, on peut dire que ça a la même valeur. C'est ce qu'on fait aussi pour les emplois. On regarde les habiletés, les qualifications, les responsabilités, les efforts, les conditions de travail. Quand on fait un processus d'équité salariale en résumé, on doit avoir des bonnes descriptions d'emploi. On doit savoir qu'est-ce que les gens font réellement dans le travail. Ensuite, on fait l'évaluation. On donne un pointage à chaque emploi. Puis, finalement, on peut comparer, et une fois qu'on a fait les pointages, on peut comparer les emplois à prédominance féminine et ceux à prédominance masculine. Si la valeur est la même, le salaire devrait être le même. Et à partir de ça, on est capable de déterminer les salaires juste pour les emplois à prédominance féminine. Maintenant, au Nouveau-Brunswick, en 2008-2014, avec les pressions de la coalition, entre autres, le gouvernement du Nouveau-Brunswick avait décidé de faire des évaluations d'emploi dans 4 services qui sont dans le secteur privé, il faut le dire, comme le disait Rachel au début, mais qui sont quand même mandatés et financés en tout ou en partie par le gouvernement. Donc, ces 4 services, c'était les soins à domicile, les maisons de transition pour les femmes victimes de violences, les résidences communautaires et les services de garde à l'enfance. Les résultats ont été plutôt bas, 12,50 l'heure jusqu'à 14,80 l'heure. Et le gouvernement allait faire les ajustements nécessaires, quand il y en avait à faire, sur 5 ans, sans indexation. Notre réaction à la coalition, c'est que ces résultats-là sont beaucoup trop bas. On a analysé comme il faut le travail qui avait été fait, puis notre conclusion, c'était qu'il y avait des problèmes méthodologiques qui avaient mené à des salaires trop bas. Donc, on voulait revoir ça. En 2018 jusqu'en 2021, on a eu la chance de faire un projet sur la valorisation du travail dans le secteur des soins communautaires et on a regardé 6 services. 3 des services que le gouvernement avait déjà évalués, c'est-à-dire les soins à domicile, les résidences communautaires, les maisons de transition pour les femmes victimes de violences conjugales, mais on a aussi ajouté 3 autres services pour pouvoir avoir une vue d'ensemble vraiment et pouvoir assurer qu'il y avait une certaine cohésion dans l'ensemble des services. On a ajouté les foyers de soins spéciaux, les services de soutien aux familles, puis les agences de programmes et services de soutien et à l'emploi. C'est les agences qui aident des personnes qui vivent avec un handicap ou bien non avec une maladie mentale, qui veulent intégrer le marché du travail. Donc, on a des services pour les appuyer là-dedans. Maintenant, les résultats que nous, on a obtenus étaient vraiment différents de la première ronde à cause qu'on a révisé la méthodologie. Les résultats varient entre 22 et 44 $ l'heure et 25 et 91 l'heure selon l'emploi. Mais les salaires d'entrée étaient de 14,50 jusqu'à 16,80 dans la plupart des services parce qu'il y a eu des ajustements là, depuis 2014 quand même. Mais on peut quand même constater qu'il y a des grandes différences entre le salaire équitable et le salaire d'entrée actuel. Ça varie de 7,80 jusqu'à 9,11 sur mon tableau ici. Avec les autres emplois, résultats très semblables, encore des grandes variations entre les salaires équitables et les salaires d'entrée actuels. Tous les résultats, toute la méthodologie sont présentés dans 2 rapports qui sont disponibles sur notre site Internet en français ou en anglais. Maintenant, je veux, en conclusion, faire part de mes réflexions sur les gains qu'on a pu faire avec notre processus, mais aussi les défis. Les gains, c'est certainement qu'on a pu déterminer des salaires équitables. Ce qui fait que quand les gens du secteur disent « on veut augmenter les salaires sont insuffisants », c'est difficile des fois de dire « OK, qu'est-ce qui est le salaire suffisant? » Bon, ben, c'est le salaire équitable qu'on propose, c'est-à-dire le salaire qui serait équitable quand on compare à des emplois à prédominance masculine de même valeur. Puis ensuite, ça a donné des outils de revendication, des buts communs pour le secteur. Ça, c'est probablement les plus grands avantages qu'on a eus avec notre exercice d'équité salariale, le deuxième, celui que nous, on a fait. Mais les défis, c'est que c'est des exercices qui ont été faits sans l'engagement réel du gouvernement. On a eu de l'aide d'employés du gouvernement, mais on n'a pas... C'était pas une initiative qui partait du gouvernement. Donc, il n'y a pas vraiment un engagement de faire les ajustements qui pourraient être nécessaires et de faire donc les investissements publics qui sont nécessaires pour atteindre l'équité salariale. Il faut passer à ce moment-ci par la revendication, la négociation. Donc, ce sera mes plus grandes conclusions pour l'instant, puis ça me fera plaisir de répondre aux questions plus tard.
Merci, Johanne. And now I'd like to turn the floor over to welcome Tina Learmonth. Tina is the president of the New-Brunswick Home Support Association. Tina, the floor is all yours.
Thank you so much. And thank you, Johanne, for going ahead of me. Technical difficulties are always a welcome surprise when you're going to present. So good morning, everyone. I'm so happy to be here and talk about such an important subject. The goal of my presentation and my time with you today will be two primary objectives. One, to highlight what the Provincial Steering Committee is, who it involves, why, and what services are involved. And I will wrap up with an overview of voluntary certification in the province of New-Brunswick, what it is, how it works, and what are the challenges. So the Provincial Steering Committee was first convened back in January of 2015. And when I was doing the research for this presentation, I had to double check that number. I can't believe that this project's been going on this long. The memberships includes representatives from the Human Services Coalition of New Brunswick. And there's 5 components of that coalition. And it's a grassroots coalition really that came together for one purpose, to have a shared voice when speaking with government. It's comprised of the New Brunswick Special Care Home Association, New Brunswick Home Support Association, Non-for-Profit Residential Association, Association of Supported Employment, and the Association of Family Support Service Providers. So really a diverse group of individuals, mainly comprised of PSWs, personal support workers, and human service counselors / family support workers. Senior government officials around the table, there was representatives from the Department of Social Development, Department of Post-Secondary Education, Training and Labor, and the Department of Health. So if you can just envision with me a boardroom that was essentially set up in a hotel that had at any given time 25 plus people sitting around a table. It was a huge initiative to get these people together for an entire day, a few times a year, on a shared goal. And that shared goal was enhancing the recruitment and retention of appropriate human service practitioners employed by both profit and for non-for-profit agencies in the community-based health and services, social services sector. So that's a mouthful, all to say we need employees and we need them yesterday. And there was a shared goal between government and the community services sector, recognizing that we needed to work together on this. So our objectives included putting together terms of reference to provide direction for future and ongoing projects and working committees that will help enhance this recruitment effort. It became a forum for improved communication and meaningful consultation. So now, for the first time, instead of government meeting with all these different segments of the community sector, we were coming together as one. And finally, the committee became a forum for functional collaboration. I talked about those shared goals and those shared outcomes that we were trying to get to, which is enhanced recruitment and retention. So one of the things that came out of these meetings was a designation of both personal support worker and human service counselors as actual designated occupations in the province of New Brunswick. Previously, we learned when we did a study across New Brunswick that a personal support worker, for example, was called a variety of things depending on the agency, depending on the person you were talking to in the community, depending on the workers themselves. They were anything from a homemaker, a home support worker, a personal support worker, a personal care aide, or just that girl that comes in and cooks for my mom. So we realized very quickly that we needed to professionalize this sector. So in February, the New Brunswick Human Services Coalition came together and 2 applications were submitted to the AOC board, the Apprenticeship and Occupation Certification Board in New Brunswick. One for PSWs and one for human service counselors. In May, the New Brunswick Human Service Coalition formally presented the case for these designations. I presented on behalf of personal support workers, and a separate presentation was done on the same day for the human service counselors. So the designation was rendered within a few days in favor of both of these occupations. The Apprenticeship Board of New Brunswick realized very quickly that it was in the public's best interest in terms of safety, having a standardized understanding of what these occupations were. I'll give you an example. If you have a leaky faucet in your house, you know to call a plumber because you know what a plumber is. And unfortunately, before we started this work, not everybody understood exactly what a home support worker was, sorry, a personal support worker was and what they weren't. There wasn't a defined understanding of what their scope of practice was, what they're allowed to do and what they're not allowed to do. This was a good thing for the employees, and this is a good thing for employers. And so once the designation was approved, that's where the rubber really hit the road. We had to get to work. So under the Occupational Certification Act, program advisory committees have to be struck. It's really important that it's not just the people around the table that came together and made all the decisions. There was consultation around the regions for both designations, upwards of 20 meetings. It was a bit of a traveling roadshow for both designations. Consultation included employees, employers, employees being the most important part, in my opinion. Representation also from different stakeholders and different partners around the province. For instance, Alzheimer's Association, anybody who has clients or individuals that they support that would benefit from these services. And the first meetings began in 2018. And so what I'm going to do now is segue into a really high level presentation on what getting certified looks like. And this is some of these slides that I'm using for this segment of my presentation are directly from what is being used from the province. The provincial committee has put this together. It's what we've used for employers. It's what we're using for employees. And all of the pictures are real actual employees working in New Brunswick. So why is this voluntary? Why this voluntary program, sorry. So getting certified, so a certified personal support worker or a certified human service counselor gives confidence in the sector. It ensures that everybody has the same education level, the same quality of services are being provided in the communities around New Brunswick. Because what we were seeing early days when we were doing the research and all of the surveys and whatnot, we were seeing that somebody in an urban center, St. John or Moncton, for instance, might be getting one quality of worker, and maybe in the rural communities, they were just getting somebody who didn't have the same opportunities as someone in an urban center to go for training, or vice versa. There wasn't a really standardized understanding of what these caregivers should have for training and what they could do. And it varied depending on where they worked, depending on what region they were operating in, what they could do and what they couldn't do. And so the idea is to have standardized training, standardized testing, and standardized competencies. And so what was done, a pretty extensive research, I guess, exercise in speaking with employers, employees, all around the province, non-for-profits, profits, large companies, small companies. You know, what do you do as a caregiver? What are you doing in the homes? What are you doing in the special care homes? And we realized very quickly that people working in home support in the community, people working in special care homes, pretty much doing many of the same competencies, similar to different things in the human service counseling and family support worker context. And so very quickly, different competencies and expectations were mapped out for what these roles would include. And so the idea between certification, or behind certification, sorry, is to allow the public to understand what they're hiring and who they're getting in their home and what's going to support them. And so this is hopefully opening up the door for our employees to have a rewarding career path. Future state might include career laddering and things like that. Gives our employees recognition for their credentials, competencies, and experience, improves public confidence, and also, again, fostering a consistent standard of care. Oh my goodness, I apologize. Another actual employee. I will also share that this is the first in Canada. New Brunswick is really a pioneer in this area, which is exciting. And so PSWs can participate. There's right now we're in what we call the legacy period, the legacy phase, or the grandparenting phase. So people who are currently working in the field for a period of time will, if they meet a certain amount of hours and have the right kind of training. So example number 1, 8,000 hours with no actual training. They've just been a person working in the field forever. They can apply for certification through the grandparenting. Somebody working 3,000 hours within this time frame that do have the current day approved training, they can apply for certification. And eventually, once the grandparenting phase closes, and it will close within a couple of years, it'll move to the standardized training program. And should you choose to become certified, then you will have to challenge an exam that would be invigilated by the province. So the question we get from caregivers all the time is, will this increase pay? And I'm going to call this out as a barrier to the sector, because we all agree that this needs to happen. We all agree that a well-trained employee is good for the employee, and it's good for the client receiving care, it's good for New Brunswick. Unfortunately, we are all doing it with the hopes that government will invest in this sector and allow these employees' pay to rise to the level of pay equity and where they need to be. But unfortunately, when employees ask this question, all we can tell them is we hope that it does. So again, the advantages for employees, having their credentials acquired and competencies recognized provincially, professional status and public confidence in the occupation. And I will tell you, employees overwhelmingly support this. They want the work that they do to be recognized. They want to be certified. They want the province to recognize what they're doing. For employers, it's really good because you'll know what you're hiring. You'll have an understanding of what they're truly trained at and in and where their level is. And it'll just give confidence as an employer as you're hiring people and knowing that you're putting a certified employee out there. And I should just share also that this has been a collaborative effort through all of these logos here. I mentioned them at the beginning of the slide, the different sectors in the community, the province of New Brunswick. And I just want to close by commenting on a few things. I didn't really highlight the pandemic, and I didn't do that purposely. The pandemic has thrown our sector into the spotlight like never before, but the pandemic is not the tipping point of home care and community care being in jeopardy. The pandemic is highlighting us, and there's heroes in healthcare, and there's all kinds of wonderful stories and things being shared out there. But I just want to share some stats with you for consideration. In 2025, and this is speaking of seniors, because seniors is my wheelhouse. In 2025, we are going to have over 88,000 seniors over the age of 75. By 2030, that number jumps up to 108,000 seniors over the age of 75. And by 2040, that jumps to 141,000 seniors over the age of 75. And if you're doing the math, from 2025 to 2040, that's 71,000 more seniors over the age of 75. Think about the situation we're in now. Think about how hard it is for us to recruit and retain caregivers. And one last comment that I'll leave you with. In the past year, and this is specifically on home support because the Assistant Deputy Minister was kind enough to send a thank you out to agencies to share with our employees. This past year, home support workers provided 8.8 million hours of home care services to 93,000 New Brunswickers. 8.8 million hours of home care services to 9,300 New Brunswickers. That's the equivalent of over 4,500 full-time positions. Thank you so much.
Wow, thank you so much, Tina. That was really insightful. And thank you to Laurie and to Johanne as well for sharing the important work that's being done in New Brunswick. This is a really exciting place to turn the floor over to some of our questions. Alors, nous allons procéder à vos questions. Si vous avez des questions pour les panélistes, veuillez inscrivez-les dans le QR et indiquez à qui vous les adressez. Vous trouverez le bouton QR au bas de votre écran. Les questions qui n'ont pas été abordés au cours de cette période de questions pourront être posés plus tard lors de notre discussion ouverte avec nos intervenantes. So as the questions are starting to come in, I will take the opportunity to ask the first question to Tina. And you raise such important points about the hopes of increasing pay and opportunities for progression. And so I'm wondering if you could speak, although it's new, to how the take-up's been so far in New Brunswick, and what are the next steps in the shorter or in the medium term?
So the uptake on the certification?
Yes.
Yeah, so there's a lot of buzz. A reaction and feedback has been extremely positive from the sector. And so right now we're in the process of just waiting on employees who are applying. Agencies are supporting them, filling out their forms and things like that. And I know the regional officers, forgive me if that's the exact title of the pedal officers, but the regional officers, pedal has been so kind as to designate kind of a team in the different regions that are I guess subject matter experts in this area that are ready and willing to support this cohort of employees in the province to become certified. So there's a lot of work moving in the right direction. In terms of how many people have actually certified to date, I don't have that number. It's too early. But in terms of next steps, the grandparenting phase of this will, as it always does, close, and we will transition into take a standardized training program. You do X amount of hours, and then you are, should you choose to challenge certification, the exam, then you do it.
Great, thanks, Tina. So the next question that I see in the Q&A is for Johanne specifically. So why do you think there's no protection for private or parapublic public sector workers under the New Brunswick Pay Equity Act?
Well, unfortunately, the act that we have only covers only applies to the public sector per se. It doesn't apply to what we would call the parapublic. Why? That's a very big question. We are actually promoting pay equity legislation for all of the private sector so that we would have protection for people working also in the caregiving sector, but in all of the private sector. We know that most women are working in the private sector, so that's certainly one major step forward that we're looking at.
Wonderful, merci Johanne. So I see actually lots of questions coming in specifically for Tina around certification. There seems to be a big appetite for talking about certification and the work you're doing. So this question comes from Patricia Findlay, and the question is, who bears the cost of certification, both directly and in terms of the time taken to undertake certification?
So that's a great question. During the grandparenting phase, I don't know why I can't say that easily, typically under the Apprenticeship Act in New Brunswick, there's actually a fee. But I'm really happy to say that New Brunswick has subsidized that fee. So caregivers right now who are choosing to get certified, I don't have to pay anything right now. It's been waived for them. Waived, subsidized, however they're working it within New Brunswick, but there's no cost to the employee right now. Future state, it's if a new employee entering or a new candidate enters a training program and choose to be a PSW in the future, once grandparenting is done, it'll be just like anything else. You know, if you're going to school in the future, you have to pay for your schooling and then you go through the apprenticeship model. Having said that, right now, because PSW is an identified priority occupation in this province, and I'm speaking solely of PSWs, you all see the same news that I see. The province of New Brunswick is heavily investing in supporting education for this particular occupation. I don't have the numbers on that, but I think it's like north of 300. They funded seats for both CCNB, New Brunswick Community College, trying to inject some capacity into the sector.
Great, thank you. And one final question actually goes out to Laurie. And we were wondering if you could speak to the complexities of unionization for a predominantly rural province, and particularly, as you pointed out, with very small numbers in each of the workplaces. So the question's about the complexities of unionizing in small workplaces and in a rural province.
I definitely see that there is a need, I think, for unionization, just because I think that it would be a more unified, and it would be create more leverage as far as dealing with the government and putting pressure on the government to create, you know, better wages in our sector and offering benefits to our area, especially where it's predominantly female workers. So I definitely see, and the barriers are for us to create unions is the fact that there are so many independent employers. So it creates a very hard challenge, especially being all over the province. And of course, we need to develop, I think, a unified system with dealing with the government and putting pressure on the government to create better wages in this sector. And I think it would create a lot better standards clear across the board if we had, and to keep it all public as well. I guess I'm for public and not necessarily all private. Thanks.
Wonderful, thank you. And thank you so much to all three of our panelists. We have more questions that have come up in the Q&A, and we'll hang on to those and we'll come back to them in our open discussion at the end of the event. So as we move forward, it's with enormous pleasure that I welcome our keynote speaker joining us today from Glasgow, Scotland. Professor Patricia Findlay is the co-chair of the Scotland's Fair Work Convention. She is Distinguished Professor of Work and Employment Relations and the Director of the Scottish Centre for Employment Research at the University of Strathclyde Business School. Patricia Findlay is an expert in the study of work and the management of the employment relationship. She's an expert in job quality in particular, and her research focuses on improving job quality, including through workplace practice reconfiguration and technological change, workplace skills and learning, improving equality, and workplace governance and decision-making. She currently leads a major UK Research Council investment on work engagement and innovation. Her research is for and with funding from councils, government, trade unions, employers, and third sector organizations. Among a long list of important contributions that Professor Findlay currently makes in the Scottish policy landscape, Professor Findlay is a member of a number of Scottish government advisory groups, including the Gender Pay Action Plan Steering Group and the Commission on Business Purpose. She currently sits as a member of the Scottish Council for Development of Industry's Productivity Club Steering Group and as a member of the Scottish Apprenticeship Advisory Board's Gender Commission. And with that, I'm absolutely delighted to turn the floor over to Patricia Findlay. Thank you and welcome.
Thank you, Rachelle, for the invitation, and thank you to the group for being part of this group and for the kind introduction. And thank you also for the simultaneous translation, which I very much appreciated in the early part of the event. Much of what you've heard, what I've heard already, is very familiar in discussions of social care, and much of what you will hear from me, I think, will also be pretty familiar in terms of the experience, because I think there are real challenges in the provision of social care across the globe. And I'm going to try to share my slides with you and hope that that works. Okay, so as Rachelle says, I'm kind of speaking with two hats on. I work as an academic and a researcher in a university. I also co-chair Scotland's Fair Work Convention, and I'll talk to you in a moment about what that means and what that does. I should say I have put rather a lot of content on the slides, partly because I thought you might struggle with my Scottish accent, and partly because Glaswegians often, if they get excited and enthusiastic, speak very quickly, and I might lose some of the audience. So I will hope that you'll pick up that from the screen. I suppose the obvious place to start off is what are the challenges across the globe, really, in terms of providing social care. I spoke to a leading public health official just prior to the pandemic, who said that he thought that the delivery of social care services was one of the biggest problems facing countries across the world, particularly in the advanced nations where social care provision is more developed. Part of that, of course, is to do with what people have talked about earlier, increasing demand and the demographics. The population are living much longer, but they're living longer with more complex needs, and those complex needs need more complex and more sophisticated social care support. All social care systems, with perhaps the possible exception of some of the Nordic countries, operate under significant financial pressure and cost constraint. That's a particular challenge in the UK after a decade or more of austerity in public funding. There are real challenges about what the social care sector looks like, who provides it, what kinds of organisations, is it provided publicly or privately, is it provided by a mixed range of sectors. There are real challenges which are not particularly about the workforce, but have real implications for the workforce. So who is eligible to have social care services? How is that assessed? What quality of services is available? What are people charged for services? And how does that operate in distinct countries and regions? Most advanced economies are exceptionally interested in the quality of provision and service, so making sure that these services are good for users, which is crucially important. It is the job of the state to provide for our citizenry, to protect them and to provide for their well-being. And therefore, the quality of provision and service is crucially important. And that has a knock-on effect for the job of the workforce and for the regulation of their skills and of their work. It's very interesting, and I'll come back to this in a Scottish context, what the relationship might be between social care systems and healthcare systems, because they are often very distinct, but in actual fact, there are huge implications for the healthcare system of a functioning or dysfunctional social care system in terms of the extent to which people need hospital admissions or can exit hospitals quickly after a stay. And in that relationship, social care workers and social care systems are often a poor relation, not treated in the same way and not recognised in the same way in terms of the value and skills of their workforce. And there are huge service design pressures. So that's to respond to changing patterns of need, ensure that that quality of service is provided, to ensure that there's flexibility, and indeed, not simply just to support users, but to support the many informal carers who provide support services to people who require them. Let me talk to you very quickly about Scotland. So Scotland has some really great things about its social care system, the most prominent of which perhaps is free personal and nursing care. By and large, people are not charged for personal and nursing care in Scotland, although there can be some charges beyond a certain level of income. They are generally not means tested. There is quite a long-standing debate in Scotland of the need to reform and improve social care services in order to both deal with the challenges of resource constraints and financial difficulties for governments who largely fund social care, but also to meet the changing demand and changing models of what social care should look like. The key focus in Scotland has been towards maximising independence for people who are in receipt of adult social care, so that they can be supported to live at home for as long as is possible and as long as they want to. And also redesigning over a number of years, redesigning the system towards a more outcomes and human rights focused approach. So giving people more power over the decisions that are made around their own care through, for example, models of self-directed support, where the care recipient becomes the employer, and workers are funded through public funding to provide those care services in that context. And also through delivering more locally based models of care, which is a particular challenge in Scotland and may well be in Canada, to deal with issues of rurality. Alongside that, we've had a long process of developing care standards and care qualifications, and social care workers in Scotland require to have those qualifications within a fixed time period of being employed. There's not a lot of workforce planning for the social care system in Scotland, but it is beginning to emerge and to be aligned with the system for planning healthcare in the NHS. Across all of that, the policy focus has really been on putting the service user at the heart of the design of services, and that's rightly so. But in the process of that, there have been a number of initiatives where workers have not been involved, have not had a voice in them, and therefore there has been less of a recognition of the strain on the workforce's capacity to be able to deliver these new initiatives and to be able to respond creatively to what users need. If I can just very quickly say something about our social care workforce, it's just over 210,000 strong. It is mostly female, 85%. I think we can confidently say that some of the features of their work would not be features of their work if it was not an almost entirely female sector. The care workforce is older than average than Scotland's workforce, 45% above 50, which means that often these are women who have their own personal care responsibilities alongside working in care. Only 3% come from an ethnic minority background. The levels of ethnic minority population in Scotland are between 4 and 5%. Only 2% of the workforce report having a disability, which is relatively low given predominance in the population. Across all aspects of social care, frontline care roles predominate, so most of the investment and most of the money and most of the workforce are in direct client-facing services, although there is some subsectoral variation where there are a larger proportion of managers involved. Most people don't work on what we call 0 hours or no guaranteed hours contract. There's a small proportion of the workforce who have those contracts, but it's a little bit higher in care at home services. Half of the workforce employed full-time. Frighteningly, average earnings within social care were 56% of the Scottish average in 2016, and many social care workers outside of the public sector will be earning the real living wage, which is currently in Scotland £9.90 an hour. Turnover is a huge problem. It's a challenge. It's about 30% per annum at the moment. They are getting worse. Part of that is to do with the nature of work and employment, the availability of alternative employment, and indeed part of it is due to the consequences of Brexit, where Scotland has lost a significant proportion of the migrant labour force. And there's no real oversight of all of these workforce issues in Scotland, or there have not been discussions of those until relatively recently. Where do we come at that from a Fair Work Convention point of view? Well, let me tell you very quickly what the convention is. The convention was established in the Scottish Government. It's independent of government. It's a small body of employer, union and academic members. It works on the basis of social partnership and social dialogue. Our job, our remit, is to bring together all of that expertise to do two things. One is to advise the Scottish ministers on fair work, and the second is to advocate and promote fair work in Scotland and beyond. And what we did in our early phase before launching our framework was to do an extensive evidence review and a consultation across Scotland, and social care featured very heavily in that, which I'll return to. The idea that lies at the heart of the convention's activities is that what happens in workplaces and when people work affects every one of us. That there is an interrelationship between how we experience work and how we experience life as citizens. That the conduct of what happens within businesses and other organisations is of a significant public concern, that policy has an important role in shaping what happens within workplaces as well as in the wider labour market and in the economy. And crucial to how we function is that it's important to address wicked problems like the provision of high quality social care through multi-stakeholder dialogue. And that's what we do in a variety of contexts. We have a framework, which is on the slide, which I won't go through in any more detail, but it's maybe worth for the future, for the rest of this discussion, for me to focus on what we say fair work is. So we say that fair work has 5 key dimensions. It offers effective voice, opportunity, security, fulfilment and respect. And later on in this presentation, I'll look at some of the evidence around those dimensions for the social care workforce. We argue very strongly that fair work is a balance of the rights and responsibilities of employers and employees or workers, and that we cannot have forms of work arrangements where the burden of flexibility and risk lies heavily or solely with employees while employers gain the benefit of flexibility. But fundamentally, what we believe is that fair work generates benefits for everyone, for individual workers, for their families, for their communities, for the organisations, private, public or third sector that employ them, and for society as a whole. We have a vision that Scotland can lead in fair work, where fair work drives success and well-being and prosperity for all of Scottish society. And we had one recommendation from a very long consultation, which is we should do it. The organisations of every type in Scotland should work hard to deliver fair work that as defined by the Convention and the Convention's framework. Very briefly, what does that mean in terms of our working with government? Because I think this will become important a bit later on in the conversation about social care. We're an independent organisation. We were established by the Scottish Government. We have a secretariat that is funded by the Scottish Government but works to the Convention. We try to work closely. We value our independence very highly. We are not afraid or concerned in any way about having disagreements with government. We do try to establish close working relationships, and we try to be a critical friend where possible, but we don't always endorse each other's position. We've engaged in quite a lot of influencing activity around aspects of funding, so the promotion of what we call the real living wage across all of social care, no matter who provides it. Some quite important work around how social care services are commissioned, including the notion that there should be fair work conditionality attached to public funding. So if you're an employer, a third sector not-for-profit or a private sector employer, you should deliver fair work in order to be funded by public funding, and that conditionality should be an explicit part of the arrangements between government and employers. We've also been involved in pursuing appropriate national performance targets, so that the kinds of things which support fair work are part of what the government aims to deliver and measures its progress in relation to. And the very first thing that we did as a convention after publishing our framework was to start an inquiry into social care in Scotland, because the concerns that had been raised around social care were more significant than in any other sector of the Scottish economy. And so we launched an inquiry in 2018 that lasted about 18 months and reported in 2019. What we found have lots of echoes to what people discussed earlier. So lots of low pay in the sector, real challenges, which I'll come back to, around the implementation of the real living wage adoption. A huge concern about how undervalued social care work and social care skills were, and how closely this was linked to the gender of the workforce. Huge disparities between people working in health and people working in social care in Scotland, despite the fact that health and social care are integrated as a policy framework in Scotland. They are supposed to be treated together. But the rates of pay, the conditions of work, the extent of voice within the National Health Service versus social care organisations or the social care sector are oceans apart. Huge concerns over lack of voice and visibility of this workforce. Big challenges, as I've said, around recruitment and selection, the way in which people can access training, which is required in what is now an increasingly professionalised service. Some of the real challenges around the personalisation agenda and the self-directed support system, where a balance needed to be struck between the important rights of users and the rights of workers to work in fair conditions. Big challenges of fundings and budget, and huge issues around how social care is commissioned and contracted. And this legacy, which I'll go on to talk about, of the purchaser-provider split. The people who pay for social care services are not, by and large, the people who deliver social care services, and that causes a real problem. I'm going to very quickly, I'm not going to talk through all of these slides, but very quickly talk a bit about the experience of social care workers under each of our fair work dimensions. And you remember I said that there were 5 of those. And as well as having a consultation and discussing with social care workers, we also used a research survey to try and get some more systematic information about their day-to-day work experience and their views. So we argue really strongly for security of employment, because we believe secure employment actually underpins a successful life. That's security of employment, security of income, security of working hours. Security allows us to plan to have a successful life, to run a family, to work in a community. We think that's crucially important for the well-being of individuals. But security of work is also really important for organisations. Employers benefit from having workers who feel secure, because secure workers are much more likely to offer discretionary effort and behaviours, much more likely to be committed and to be engaged in high trust relationships, much more likely to want to learn and develop their skills, and crucially, in social care, much more likely to want to stay. For society as a whole, secure work is good for us. Secure work means that we don't spend as much on welfare, we get more through taxation, we can address real challenges around in-work and child poverty, and we can improve people's health, because insecure work is heavily associated with much poorer health consequences. If we look at the social care workforce in relation to those security criteria, we find that they have poorer terms and conditions than their counterparts in health services, that a significant proportion of them, 46%, feel that their pay is unfair compared with other local jobs, and perhaps not even local jobs of similar qualifications and skill. Many people compared themselves to supermarket workers who were paid equally or above what social care workers earn. Huge challenges around not being paid properly, not being reimbursed for travel costs, previously also not being reimbursed for travel time, work-related phone use of the internet, uniforms, etc. Big challenges in terms of people's predicted working hours around rota predictability, long hours and unreasonable expectations about availability for overtime, with 16% delivering unpaid overtime weekly. And what's going on in this space is that the attempt to be fully flexible and often associated alongside understaffing means that existing employees might have short contracts, maybe for 16 or 20 hours a week, but are regularly asked to work longer hours, which is a problem, because if you work a 16-hour contract, even if you work 35 or 40 hours a week every week, when it comes to sick pay and holiday pay, your calculation of that pay is based on your contractual hours of 16 hours. So you might never get the sick pay and holiday pay to which you really should be entitled. And that means that where employers are relying on what might be relief banks of staff hours, that produced really difficult schedules of work for social care workers, unpaid downtime in the middle of the day, lots of unpredictability, requests to take on additional working hours during that particular working day. So real security concerns. I mentioned earlier this idea of the real living wage. The real living wage is an independently calculated amount based on living costs in the UK. And I said it's £9.90 for anywhere outside of London and £11.05 for London. Scottish Government a few years ago decided that all social care workers, irrespective of the sector that they were, the subsector they were employed in, irrespective of whether they were in the public, private or third sector, should all be receiving the real living wage. And given that about 84 to 90% of social care is publicly funded, then government has quite significant leverage to deliver this. That has been really important. I wouldn't underestimate the importance of that. It has increased the wage floor, so nobody falls below it. But it's had other quite challenging consequences. It doesn't, for example, deal with the fact that you might get very low hours in 1 week, although more recently, living hours have been part of the aspiration within social care in Scotland. But it also meant that pay differentials were a bit disrupted. There was no mechanism for undertaking, outside of the public sector, the directly employed public sector care workers, there was no mechanism for undertaking job evaluation and therefore upgrading the wages of those who weren't entry-level care workers, who had greater skills and experience, and that's been a real challenge. It's also created real challenges around supervisory positions, so it's led to pay compression, so that people in supervisory positions really earn very little above new starts, despite taking on significant amount of responsibility and additional task. And what that has meant is it has become increasingly difficult to recruit team leaders and seniors. People are reluctant to take on that responsibility because they don't really benefit from it individually. And you'll see the quote on the slide makes that clear, that people don't want to take on extra responsibility of all of the complex areas of their job, interacting with other professionals without adequate recompense for so doing. I think the second really huge challenge in the sector, and it was discussed earlier in the session by Laurie, it was this issue about voice. How do you get an effective voice for workers in the sector? Again, from a Fair Work perspective, we think voice really matters. It matters to ourselves as individuals that we can raise concerns and interests at work. It's really good for organisations because it identifies problems and challenges, and it also is important for improving organisational performance. And actually, voice and skills are great talents for the wider community and society as a whole. And being able to engage in debate and dialogue, solve problems, identify opportunities is crucially important. In Scotland, only 19% of care workers have their pay and conditions delivered through collective bargaining. There's a limited union presence outside of the directly employed public sector, and workplaces are, of course, unconventional. About 54% of the funding for Scottish social care is for at-home services. So those are really odd workplaces to organise for trade unions. The sector is, the workplace is somebody's home, and that makes it much more challenging from a union organising point of view. The employers themselves tend to be small, either in the third or not-for-profit sector, or indeed in the private sector. Outside of the care home subsector, employers tend to be relatively small. That makes it much more difficult, again, for unions to organise, even outside of the workplace issue. That's not to suggest there aren't voice processes within social care organisations in Scotland, but there are some real concerns raised about whether these are genuine opportunities to be heard. And they clearly don't have any independent leverage on the employer other than to share employees' views. And that's a problem, not just when it comes to the terms and conditions or work experience of the social care workforce, but as I said earlier, it's a real issue when it comes to service redesign, because the redesign of services doesn't always take into account the extent to which the current workforce and the future workforce can deliver those services as specified. And managers and leaders within the sector understand that. There was actually quite an interesting coalescing of views between employers and employees in the sector, because both work under the constraints that the funding model and the funding system causes for the sector as a whole, and causes for individual employers. So there's actually quite a lot of circumstances where the employees were not angry at their own employers particularly, but were angry at government who provide public funding for the service, and in their view, insufficient public funding. So that whole issue around voice was increasingly problematic. When it comes to opportunity, we think opportunity matters. You need to be able to participate in work on equal and fair terms, and you need to be able to progress, because that allows organisations to harness lots of talent, and it breaks down labour market inequalities. And because of the regulated nature of the sector, because everybody has to have a qualification within a set period of time, there are undoubtedly a range of learning and training opportunities and options delivered at different levels in the sector. The real difficulty, and if you think about my earlier point about unpredictable working schedules, the real difficulty was how people could schedule learning time, whether they could balance their own work and life and learning commitments. And that was really exacerbated by the fact that there was understaffing and recruitment problems. If you were understaffed, people were taking on more hours and therefore found it really hard to find time to learn. Most workers wanted to stay in care, but they couldn't see it as a career. They couldn't see where they would go in terms of future opportunities and building a career in the sector. And that was a big problem for managers and employers, because they understood that not being able to offer an attractive career made it much more difficult to be able to recruit and retain the best workers in the sector. If that all sounds a little bit bleak, when we came to looking at fulfilment as an element of fair work, the social care sector really steps ahead almost of everywhere else. Fulfilling work is important for how people derive meaning from their work, have a sense of purpose, have a self-belief in what they do. When people are fulfilled at work, they tend to work better, they're more engaged, they're more creative, they're more productive, they're more innovative. And fulfilling work actually is worth it, because we spend in Scotland and in other advanced economies lots of public funding on investing in the human capital of our labour force, and we want them to have opportunities in work for workers to be engaged in fulfilling work. And there is no doubt that the social care workforce in Scotland saw themselves as being engaged in meaningful, fulfilling, even if complex and emotionally challenging work. So 71% thought it was meaningful, 75% were satisfied, 80% shared the values of their own organisation and saw them as being motivated by it. What undercut that fulfilment, however, was having insufficient time to engage with service users, not enough time to offer the quality of care that they wanted to offer. And I'll come back to that in a second. Another big challenge was around supervision and support, and people accepted that supervision and support wasn't heavy-handed management, but was really important to people's professional practice, especially dealing with some of the emotional challenges of being a care worker, and especially for those who experience a lot of time working on their own. But actually, real concerns amongst the workforce that time pressures would undermine supervision, they wouldn't get access to supervision and support, and that when cost savings were required to win public contracts, supervision was the thing that was cut back, meaning that the frontline workforce didn't get as much direct support from team leaders and supervisors as it might be. And there were huge pleas in the sector to try and lock in supervision and support costs when it came to trying to fund public contracts. So huge intrinsic job quality, and I won't read out these quotes, but they would be typical of social care workers across the globe. People who feel that they make a difference, that it's a good job, that they are heavily involved and enjoy being heavily involved in people's lives, and that they get real rewards from service users' appreciation of that. Just on, I mentioned earlier, self-directed support. I mean, self-directed support operates where you hand over the budget for social care to an individual who requires it, and then they are able to develop a more personalised and responsive service that meets their particular needs and is not standardised. That's a very good thing for users, but there are real challenges in the balance of that. So users are often not aware of their responsibilities to treat social care workers fairly, of their statutory responsibilities as effectively employers. And actually, there's been a real challenge in getting training and supervision that allows social care workers to develop the right skill set to be to provide a more personalised service, because much of the contracting is around specified tasks rather than adapting social care services to the needs of a particular individual. So the idea is right, the policy is right, the implementation is, however, a little bit lacking. As I said, and relating to this issue of fulfilment, there is a lot of emphasis in Scotland on a professionalised and highly qualified care workforce. There is a lot of attention to training and development, but for some, that training and development isn't funded, either in terms of the cost of registration, the cost of undertaking the training, or indeed of the time that the time it takes to undertake the training. Hence my question earlier in the earlier session. So for a lot of women who become care workers, they return to care work after caring for their own children. They often have elder care responsibilities alongside being employed. The pressure and the time required to obtain qualifications is causing a number of them to leave the sector, not because they don't think qualifications are important, but because they can't fund them or they can't find the time to deliver them. So there are real concerns there about the extent to which skills are being developed and talent is being lost because of the system of delivering skills and qualifications. Our last dimension is one of respect. We think respect at work is crucially important. It's very good for our well-being and self-esteem. Respectful behaviour makes for better organisations. It limits legal liability, it improves trust, it improves involvement and motivation. And it's a really important part of how we engage with other human beings in the workplace and elsewhere. Interestingly, and I think I alluded to this a bit earlier, frontline workers do feel respected by their own colleagues, by their clients and by their employers, by their clients' families also, but not by the government and not by the public. So they didn't feel respected by those in power and indeed by the wider public. They felt that they were treated as being people of low skill and low value. They certainly felt that they were treated as poor relations when it comes to comparisons with those that work in the National Health Service. They did think that their employers were fair and dealt with respect and dignity at work issues well, But if we start to push at that issue of respect, so not just respect in your interpersonal relationships, but respect for your personal well-being, respect for your health, concerns over stress and overwork meant that that respect that people felt on an interpersonal basis wasn't carried through to the respect for their own long-term health and well-being. So the work was seen as very demanding. People set high standards for the work that they did. They felt really under pressure by the limited amount of time that they were given. They often did unpaid work, and all of those things undermined their own personal well-being and their sense that they were being respectfully treated. In part, some of these challenges arise from the nature of the sector. So we call it a mixed economy of public, private and third sector organisations. That wasn't always the case. I think this was referred to earlier, but previously, prior to probably the 1980s and 90s, public provision and nationally agreed terms and conditions were the norm in the UK for social care workers. In the 1990s, the then Conservative government instituted what was called the purchaser-provider split. And what that meant is the public sector would purchase care services but wouldn't provide it. And about 2/3 of the workforce moved into non-public sector occupations. And what really happened there, almost as an oversight, was that local government became responsible for the budgets, but not for the workforce, except if it was directly employed. And that meant that one element of the workforce moved on a completely different path and trajectory to another element of the workforce doing the same jobs. That whole approach to commissioning has meant a real disconnect between strategic planning and service design and then how contracts are set and managed. And many employers argue lead to a real race to the bottom, which makes it impossible to deliver fair work. So contracts are tight on financial constraints. That means that employers struggle to offer decent pay and conditions. Things like travel costs, which are particularly problematic in parts of rural Scotland, and non-funding of management costs, and some terrible examples of auctioning of contracts where providers compete to win contracts at the lowest cost. And that clearly just pushes down terms and conditions. A lot of this concern was around this idea of task and time. So you get a task and a time and you have to do it. It doesn't matter if your time doesn't stretch to that task. Some employers have moved out of elements of home care because they cannot make the numbers work. They simply cannot deliver the services and employ the staff with the funds that's made available to them. So real problems in that notion of task and time commissioning. That could, of course, be made better, and there are currently some discussions around how to do that, focusing much more on outcomes within commissioning processes, so that you say we've got a set of outcomes that this person has to have delivered to them as a service user, and it's for social care workers to decide and agree how that is done. But that doesn't happen at the moment, although it's an important element of current discussions. We have tried very hard to institute fair work clauses when it comes to social care contracts. So there is now a statutory requirement on all public bodies, including the Scottish Government, to be mindful of fair work when they engage in contracting. Part of the problem, and this is not a political point, but it's an issue of devolved government. Part of the problem is the funding arrangements for Scotland within the UK make it really difficult to offer any more than annual funding, which means that you build uncertainty into the sector because the sector recontracts every year. And that sufficient funding for fair work won't be available unless you can deal with that issue also of stability. I'm going to quickly jump past this because I want to just move on to our conclusions. What did we conclude? We concluded that social care work is fulfilling, but it's not always fair. People enjoy the intrinsic nature of the work, but they didn't sign up to have poorer pay or poorer material rewards. And they didn't make a choice to have fulfilling work, but work which was unstable or low paid. I don't think there's any confusion that the not paying fairly, not recognising the skills and contributions of that workforce, not ensuring voice and input is separable from its gendered nature and the poor visibility of care work. And that leads, I think, to common public perceptions which our care workers picked up on around how the public perceives them as being low skilled and of low value. So very quickly, what did we recommend? We recommended a sector level body for voice because that voice is currently lacking. We recommended a minimum contract standards for any public funded social care services. And that's consistent with all of our framework and approach. We recommended a complete overhaul of commissioning practices. Let me say this very simply. If we don't overhaul commissioning practices, everything else that we do won't work. Because it's the commissioning practices and the level of funding available which is creating the outcomes which are problematic in the sector. We asked stakeholders to commit to the framework, and we asked government to incorporate that into broader policy arrangements. Where have we got to? So the government agreed all of our recommendations. They established an implementation group in 2019 with a broad range of stakeholders. They were due to report in February 2021. The pandemic intervened, but as yet we don't have a strategy for implementation. We are aware that there are challenges around the organisation of worker voice and the overall funding of any changes that are made in the system. And employers are very nervous about any changes that will increase their cost base without associated changes in commissioning. More recently, and I'll finish off in just a second, there's been an independent review of all adult social care in Scotland. We focused on the workforce in our inquiry. The independent review has been a much broader engagement with the sector as a whole, but it completely reinforced and endorsed our original recommendation, and it argued for an ambitious implementation timetable. And you'll see from the timings that I just outlined, it hasn't been very ambitious so far. Crucial in the independent review is this idea that we need a sector level body that can talk for that workforce. At the moment, the workforce voice is so fragmented that there is no place in which the workforce can have an effective and influencing voice. So just to add up, just to finish off, I think there's lots of positive things about social care provision in Scotland, health and social care integration, free personal care, lots of willingness to learn from elsewhere, and it's why I'm very delighted to be part of this group, because we would like to learn from you also. The proposal from the independent review of a national care service in which there are national standards in eligibility and provision, and this broader commitment to fair work and rolling out fair work in all sorts of funding. My last slide, and happy to stop thereafter. The independent review, I think, nicely summarises some of the ways in which we should be rethinking social care. So we should be seeing it not as a burden, but as an investment, as something that enables users, that's not crisis driven, but is anticipatory, which isn't about market provision. Social care is not appropriate to be provided in a market context, but it should be something that's delivered collaboratively across key stakeholders, that it should be about building relationships, an important vehicle for people to live independently and to live good quality lives integrated into communities, and that it should be consistent and fair in its application. In all of that new thinking, it will not be delivered unless there is a well-qualified, fairly treated and highly committed social care workforce. And our job now is to make sure that that's delivered in Scotland. Thank you.
Thank you so much, Tricia. In my head, I'm envisioning lots of rounds of applause. Of course, we miss that in an online context, but thank you so much. Nous allons procéder à vos questions. Si vous avez des questions pour Professeur Findlay, inscrivez-les dans le Q&R. Vous trouvez le bouton Q&R au bas de votre écran. We have some questions that are starting to come in already, but as they come in, I'd like to start us off with a question about flexibility. And you already started to talk about this in terms of balancing the need for flexible delivery of care, as well as the needs of workers. And you also introduced this idea about the requirements of users and their decision makers as employers. And so my question is how do we balance, or what are some of the complexities of achieving that flexibility for those receiving care while also trying to limit precarious hours, split shifts, and the strain on working conditions that you talked about for those who deliver that care?
There has been a reasonable amount of work done to try and support those in receipt of self-directed support to be able to be good employers, so to be able to specify and be realistic about what they are entitled to receive and can expect to receive. And I think there's a lot of educational work to be done there. I think there's also a role for they're called personal assistants here in Scotland, for personal assistants to, although they work very individually, to work collectively as a group, and there are personal assistant organisations, for them to work collectively to try and identify this as a new system, what are the big challenges that are emerging from it, and how can policymakers help in that relationship. So not easy. The flexibility issue doesn't just, however, apply to, or the flexibility demands don't just apply to those using self-directed support or working as personal care assistants, because in actual fact, all of the organisations who contract for social care contracts in Scotland contract in the same, largely contract in the same model, which is they say, we've taken on a contract to deliver 30 people social care services during the day. That means we'll need people first thing in the morning, we'll need people at lunchtime, we'll need people at dinner time, and we'll need people at bedtime. They're called tuck calls. And there's a really fixed notion about that's how people live, when in actual fact, those hours don't necessarily work for users. What it means then is you need a bigger workforce working shorter, more flexible hours. And that's not necessarily good. One of the real challenges and opportunities, in my view, is to allow social care workers to manage their own diaries, to allow them to say, Mrs. X in Glasgow, in a street in Glasgow, doesn't like to get up early in the morning. So we can do Mrs. Y first, and we can then manage our time. Somebody doesn't need a person in the middle of the day, although we're given half an hour or 15 minutes in the middle of the day to go in and make dinner. But they don't actually need that because their family makes dinner. So we will give that person more time in the morning when they're a bit sleepy and it's a bit more difficult for them. But that currently doesn't happen because the contracting system doesn't allow it to happen. So the issue about flexibility is not just about users and personal support workers, it's about how the contracts are organised. There are some contracts in Scotland, hopefully few, but there are some where social care workers are timed electronically by the minute from when they enter a property. Now, there is no way you create a high quality responsive service when you're not only timed by the minute, but your organisation invoices by the minute to the government. We should not have contracts that look like that.
Great, thank you. Great question. Another question that I see coming in the chat is about the sector-wide body that the Commission has recommended. And I'm wondering if you could speak to some of the objectives of that body and whether or not collective bargaining is part of how the Convention envisions their remit.
Absolutely. We were very clear that the role of that body should be to give a voice to the sector, which was lacking, should be to specify minimum terms and conditions in any contract, and that should be applied across the board, and that it should become the vehicle for collective bargaining in the sector. Now, as you might imagine, that's pretty tricky. The trade unions who work mainly in the public, not exclusively, but mainly in the public sector, the trade unions are very happy with that as a recommendation. The employers less so. And part of that, I think, is because the employers misunderstand or are not familiar with what that means. I actually think collective bargaining has rather a lot to offer employers in the sector, because I think a united voice from the direct participants in the sector will make it much more influential in relation to government. I would say fairly, the Scottish Government is committed to collective bargaining as one of its national performance indicators. So expanding the number of people who are covered by collective bargaining as a national performance target. And social care would be the first big example of putting that into practice, but we're not there yet.
Thank you. So I have one question that I'm looking to try to interpret, and it's about night shifts, and potentially there's some data that in the work that the convention did with the social care sector. I was wondering if you could speak to the kinds of shift patterns that people work when they're in different residences, and whether or not people undertake 12-hour shifts or multiple 12-hour shifts, or what kind of working patterns do they work in, I guess, non-standard hours?
There are a multitude of working patterns, and those will be very different, for example, if you're in a big city like Glasgow, or if you're in an island community somewhere else in Scotland. So the working patterns reflect the scale of demand in a local area and the size of the social care workforce. If you look at public provision, so in public provided social care services, people may well work a 12-hour shift 4 days a week. which would not be inconsistent in Scotland with the, they might well work longer than 4 days a week. In Scotland, in the NHS, that's what people work. They work sequential 12-hour shifts over 4-day rotas. But people will maybe do split shifts, so they will maybe do a morning shift very early, and they might come back for an evening shift between 5 and 9, 5 and 10. There are some workers that work a very late shift, usually just to provide medication. So there's a team that does a midnight shift in Glasgow, for example, and there were stay over shifts, and this is an interesting insight into the tensions in social care. Stay over shifts were paid at a reduced rate because, by and large, people went to sleep, workers went to sleep, and they may or may not be awakened by the person to whom they were delivering care. So they were previously paid at a lower rate than the standard hourly rate. When the real living wage was adopted, the unions argued very strongly, I think, that that should be adopted for all hours. And it is legitimately the case that if you are out of your home, available to provide work, over a time period, that you should be paid your rate for that. But of course, that massively increased the cost of overnight services. And so most of those services have been cut, except when they are absolutely crucial, they have been cut. So they are now paid at the real living wage, but far fewer people get access to them. So I don't know if I've really answered your question, Rachelle, but there are a myriad of possibilities in terms of what those shifts look like. It's important to note that for some workers, that shift arrangement is good. You know, so people who have childcare responsibilities or elder care responsibilities, or people who are fitting in with spouses' working patterns in relation to family demands, sometimes those work. I think the real challenge is the extent to which people are asked to do additional hours, often on a regular basis, but are not contracted to do that. So the demand for additional hours tells you that there's demand in the system for care services. And that, I think, does go back not necessarily to the government, but it goes back to the employers to say you need to be better at the planning and scheduling of work than perhaps you are now to create a more predictable working schedule.
Great. Thank you so much for answering those questions. And I see more questions that are coming in, but many of them connect to some of our panelists, so I'll save them for that discussion. Et ce qui me frappe en écoutant nos panélistes et la présentation de Professeur Findlay aujourd'hui, c'est le rôle que l'État peut ou devrait jouer dans la gestion et la réglementation des emplois du secteur parapublic subventionnés par le gouvernement. Cela soulève des questions importantes sur la façon dont nous pouvons travailler avec les gouvernements, les décideurs politiques, les partenaires communautaires et le secteur de manière collaborative dans le but d'améliorer les soins tous ensemble. Cela souligne également la nécessité d'investir dans le secteur afin de développer ses capacités, plutôt de se concentrer sur les coûts et plus particulièrement sur la réduction des coûts. And so when I listened to the initiatives that were discussed by our speakers here in New Brunswick and what's happening in Scotland, there seems to me a real need to ensure that we adopt a systematic approach to think about employment systems and job quality. And so this, if I can invite our panelists back. So the first question that I have to get us going, and not to put the burden of solving our research project on all of you, but the first question to Trisha or Laurie, Tina, and Johanne is, how can we move from individual initiatives that impact work and pay in the care sector towards a more connected, system-wide approach to improving employment in the sector?
I think my answer would be what I've already said, which is I think you need a national voice for the workforce. If it's fragmented, we don't get a very good voice there. I think that would benefit employers a huge amount, because I think that some of the challenges are shared by employers and employees in the sector. They are to do with the level and organisation of funding. And I think that would be the big, for us, that would be the big gain, allowing that voice to shape services and service delivery, and allowing it to have an influential impact on the scale of funding. Can I just say one thing? If we could get past the point in any social care system in the world where we think it is okay for social care services to be delivered on the back of poorly paid women workers, then that would be a massive step forward. If we could actually just call that out as being something that's unacceptable. It is unacceptable to deliver a significant public service on the backs of largely exploited women workers. And that's maybe a difficult and frank conversation to have, but it's maybe the starting point for everything. We should, I have a very harsh line on this, and it's not because I don't care about the recipients of social care services. My mother is a 96-year-old, a heavy user of them. We should say if we can't fund social care, if we can't fund it because paying a fair wage and giving fair conditions to workers isn't possible, then that should be an open conversation in public policy. But it is possible, and I'll tell you why I think it's possible. It's possible. All of the recommendations of the Independent Review of Social Care in Scotland would add up to about 0.4% of Scottish GDP if we had to invest to deliver all of those recommendations. That's a significant sum of money. It's a 20% increase in real terms, but it's not an impossible sum of money. It's a question of priorities. Every pound that we spend on social care generates £2 in other sectors. Social care is important. It allows people like me to go to work. It allows people to have higher quality of lives. It keeps people out of hospital. It stops bed blocking. So that debate about having a debate which says no more in relation to a social care system which women's efforts cross-subsidise, I think would be a really important starting point. Sorry, that sounded a little bit like a rant. Apologies.
I see you're getting lots of hears and hurrahs and rounds of applause in the chat. So I think actually it's quite refreshing to put that out in the open. And the point that you make about every $1 spent in care is $2 elsewhere in the economy is something that we need to be talking about more. Absolutely. Do any of our other speakers want to tackle that question about how we can move forward from individual initiatives towards a more connected system-wide approach?
I think that bringing the care sector under the public health care would definitely strengthen the sector for the workers as well as the employers, and for those that use our services in and around our community. I think it's high time that our province invests in public services clear across this province, because in Tina's presentation, she provided a lot of good numbers about and showing us the need for the services and a necessity that we definitely need to attract and retain workers in this field going forward in the near future. So I definitely think that that we need to bring this kind of care service underneath the under public health care.
I'll just comment that I think it comes down to political will. None of the information that we're talking about today is new information to government or the citizens of this province. Everybody has their own story or their own experiences, whether it's in home care, special care home, human service counselors, family support workers. It's just, the system, the caregiver sector has been quite fragmented. That is the purpose of the Human Services Coalition, why they came together to kind of have that shared voice, and why we had employees around the table as well, because it's not about a bunch of employers thinking this is what's best for the employees. The employees had to be part of this process, speaking specifically about the certification process. But I think it does come down to political will. The time is now. It just has to happen. The numbers are there. We're going to pay for these services either at home in the community where seniors, and again, seniors is my wheelhouse, but where seniors want to be at one cost, or we're going to pay it exponentially more where nobody wants to be in hospital and overwhelm even more a healthcare system, speaking of New Brunswick, that just can't take that influx into the hospitals.
Can I maybe jump in for a second, Rachelle, around this notion of effectively nationalisation of care? So I think I did say that the previous position in the UK was that care was effectively nationalised. It was provided by local authorities in the public sector. It's interesting, the recent independent review has come out against nationalisation, and it's done it for two reasons. One, because the cost of effectively buying back the sector would be really prohibitive, but also because some of the examples of excellent care are not in the public sector. So there are some not-for-profit and third sector organisations which in terms of care standards are really high. And I think that recognition has made people think a little bit about how do we get things to be publicly provided and to have a national care system standard, but not provide everything in a one-size-fits-all from the public sector. And I think that's been quite an interesting debate for those of us who think actually take it back and bring it into the public sector is a good idea, which would have been my starting position. I do think there are real concerns about some parts of the care home sector, which in Scotland and in the UK, like elsewhere, are often owned by venture capital chains. People are making a lot of money out of social care in the care home setting, and I think there are real concerns that a really vital public service should be provided in that way. So I think there are some quite nuanced debates about the ownership of the sector, which could be separated out from the debate about the quality of service provision and the quality of work.
Great, thank you. I see a range of questions coming in that are somewhat connected, so I'm going to try my best to smush them together into a question. I think they mostly are for Tricia and for Johanne. So we've talked about challenges related to recruiting supervisory employees after raising entry-level wages. And so one of the questions is this because as a society we're unconsciously wanting to maintain those larger pay gaps between entry-level, middle-level, and upper-level jobs? Or is it because those middle and upper level jobs in the care and social care sector also need pay equity revisions? And then the related question is also, and maybe Tina might want to jump in on this, is about how do we think about career ladders and progression and encouraging people to take on those supervisory responsibilities and mentoring?
Maybe I can answer for the pay equity question. Certainly after we finished our pay equity exercise, what we promoted is to do a full pay equity exercise for all the workers in the workplace, including supervisors, because we only looked at caregiving staff. We didn't look at the administrative staff, the kitchen staff. And I think that if you want really all of this stuff is female, really, lots of women, and they should also be evaluated. The jobs should be evaluated. I don't think that supervisors are paid that much in that sector. So there's certainly a need to do the evaluation and to establish fair wage scales for all of the staff.
I'll just respond in terms of the career laddering part. It's the work of the Provincial Steering Committee. That would be like a future state, and the career laddering that we were referencing was not necessarily worker versus supervisory role. It was more about PSW to LPN to RN. That's kind of the lens in which I was referencing career laddering.
I think part of the challenge is that the social care organisations are immensely flat, and therefore the idea of progression is not really in people's sight. And I think that's poor because there are clearly variations in skill levels within the workforce, but not one that's been particularly well recognised. I think at its heart is a real challenge that people think care is easy, and how the argument runs is, people care in their families, they go out to care at work, it's much the same. It's not really a skill, it's just a characteristic, particularly a characteristic of being a woman. Therefore, why would we invest in those skills? Of course, some of those skills are really quite high level, and the appropriate remuneration of those skills would solve a lot of problems. It would allow people to stay in the sector because they can see somewhere to go. it would retain people and attract people into the sector, and it would allow for a differentiated service. You know, there is a difference in skill between providing somebody with a meal and encouraging somebody newly diagnosed with dementia to find ways of living independently. Those are different levels of skill, but they're not always reflected very well in either job categories or indeed in pay. And I think that's because it all gets lumped together into care. And as we all know, care is easy, isn't it?
I may add, I find that in New Brunswick, what I'm hearing from the public is that they recognize more and more the skills and the responsibilities of the workers in that field. But the challenge remains the political will to really invest properly in the wages. And there's always, you know, something else that seems to catch our political class interest instead of improving care. And to be fair too, there has been increases in investments in the wages in the past few years, different governments, but really at a fairly slow pace, considering that it's been such a neglected sector for many years before that, that we really have to move forward much faster.
Yeah, I would agree with that, Joanne, and I'll also comment that currently frontline workers earning under $18 an hour are getting a top up for a defined period of time because of the COVID, caregivers get excited about this, and everyone gets excited about this. And my I guess unpopular comment is thank you. However, wouldn't it be nice to live in a world where we didn't need to top them up because they were getting paid properly in the first place?
Yeah, and that ties in really. Oh, I see Trisha's wanting to jump back in. Come on.
I was going to say a similar thing. I mean, we lots of care workers in Scotland and the UK would receive working tax credits, so their pay is so low that they are topped up through a welfare transfer for doing a job that is complex and demanding, and for which they should be paid appropriately. And of course, that money comes out of the public sector. What's the problem with trying to make sure that that money is spent on proper wages rather than is spent as a welfare transfer?
And that all of this connects very much to one of the other questions that's come in. And I think Tina mentioned that the care sector has certainly been spotlighted in the pandemic. And it seems like every week, fortunately, we're getting some media coverage and discussion on it. But as you point out, many of the measures are temporary, they're long overdue, and certainly insufficient in terms of getting to the point of pay equity. So how do we start to advocate for the sector and support the sector in their advocating to make these initiatives more permanent beyond the pandemic, and I guess even go the step further and get us all the way to fair pay and to real pay, and of course recognizing that Trisha already pointed out that there is a need to overhaul the commissioning model, and that really underpins everything.
It seems to be part of our work, actually, to try to bring those conversations in the public and to keep pressuring the government to improve the wages and to make clear that it should be a priority. And how can people help? Well, definitely by contacting their MLAs, contacting the Minister of Social Development, the Premier. I really encourage workers to also bring their voice forward, and Laurie has done that beautifully many times, whether it's in the media or by writing or by meeting our decision makers. But we certainly have to be speaking loud and to keep on doing it. Like, for all that we say in the media or say to our MLAs, there are other people bringing other priorities which may not favor us collectively really as much as caregiving. So but we do have to bring our voice to the table more and more, as users do. I think users should also just bug their MLAs.
I'm just going to share also, so this conversation is largely about the employees, as it should be, who are providing the care, and the agencies that provide the oversight and the employers around the province are very much, I guess, in the trenches with the care staff. And I like Patricia's comments earlier that most employees in Scotland recognized it wasn't their employer not paying them. It was literally, this is the contract, these are the funds, and the math is the math. So employers have been advocating heavily, with employees, on behalf of employees, and this work, will continue. And I keep saying the time is now. It's like this overwhelming chant that keeps going in my head, because the numbers, every year that goes by, there's more seniors over 75 requiring care, and the care staff that we have are largely north of 45 years of age. And so there's a relationship between needing more staff, or having less staff, and needing more support there. And it's not going in the right direction. So I don't think the only answer is investing in just paying everybody, because I think if you paid everybody X amount of dollars tomorrow, we still don't have enough people. So it's a much bigger conversation, in my opinion, than just paying everybody more. That definitely has to happen. That's not off the table. It's not what I'm saying. But I think that the solution needs to be, especially in terms of home care, maybe looking at it closely and saying, okay, does everybody need to be this level trained? Is there supplementary care that can be introductory level? Could we be, doing some upstreaming in terms of working with our physicians to start talking about home care before a senior actually needs it? Maybe we have that conversation with their primary care physician when they're 60 or 55, when they're nowhere near ready needing home care, but they understand what the program is. We need to stop receiving seniors when they're in crisis and their families are broken, and trying to take care of their children, take care of their parents, keep a marriage together, and go to work. So it's a much larger conversation, in my opinion, than just pay everybody properly, because if all those other things don't contribute to the conversation and aren't part of the fix, it's just going to continue in the way it's going. People need to be paid more. I'm not saying they don't, but I think that the idea of upstreaming needs to be part of the conversation, the right level of care at the right time.
I completely agree with Tina. I think that the moment is now for the reasons to do with the demographics that you talk about, but I think the moment is also now because, as people have pointed out, unusually social care has a significant spotlight. People are aware of the role of social care during the pandemic. They're aware of the sacrifices that were made by social care workers. They're aware that they were frontline health workers who were out there, right from the start of the pandemic and throughout. And I think sometimes it is, I don't want to make light of the most dreadful period that we've lived through, but there is a sense of that as an opportunity to have a proper discussion about the role, not just of NHS workers and people that provide health services more conventionally defined, but people who support that healthcare system by the provision of social care services. And if it's not now, I can't see a more appropriate time. It's not to say that's not challenging, because of course public sectors across the world have spent enormous amounts of money funding people to not work, or to stay at home, or work part-time, or whatever. But interestingly, that money was found at the point where people needed it to be found. It was found by government. And I think the conversation about how social care can access, I agree very much with Tina, it isn't just about money. It's about all of the broader issues about the quality of those jobs, the ability to stay in those jobs, the incentive to have a career in social care. Those are significantly important, as well as pay.
Great, thank you. And I hate to wrap up this wonderful and insightful conversation. I see a range of comments in the chat, certainly echoing the need to have more women in the legislature, and tying in to Johanne's point about, make your public officials aware of these of the need to support the sector. And so just to wrap up, I want to thank our panelists today, Laurie Anderson, Tina Learmonth, Johanne Perron, for sharing their insights on the important work that's being done here in New Brunswick. I also want to give a very loud round of applause and thanks to Professor Patricia Findlay, who joined us from Scotland and told us about all of the really fascinating and important work that I think many of us have connected to that the Fair Work Convention's been doing in the social care sector. And I'm really grateful for the knowledge and expertise that you have all brought to this conversation and all of the learning that we can do together. Je veux aussi remercier Rachelle Richard et Johanne Perron de la Coalition pour l'équité salariale du Nouveau-Brunswick et mon équipe à Mount Allison, Sarah Ann Strong et Riley Livingstone pour l'organisation de cette webinaire et leurs efforts en arrière-scène. Et finalement, merci à vous, les participants, d'avoir participé à notre webinaire. Nous planifions en faire un deuxième pour partager les résultats de notre recherche à l'automne 2022 et j'espère que vous y participerez aussi. Merci et prenez soin de vous.